final lap of this conference. I think we need to start wrapping up little things. And this is something that we started around 2 months back, calling out for abstracts and starting looking at what we can. And I think the success or, one of the measures of a conference reach and our ability to penetrate into smaller sections is when you are able to attract the talent around and get people to contribute, allow them to show their work and give them a platform to represent what they have done for the past 4, 5, 7 years. And I am very proud to say that we were able to do that. We were able to inspire people. We were able to instill that confidence in people that our platform is good enough. NALCICON ISLC is a good enough platform where they can show their work and they don't need to wait for probably a bigger international platform or a bigger international conference to present their work. And in the next 15 to 20 minutes, I'll try to make up for the lost time. I'll try to summarize what we have done and who were our judges, and I'd like to call on the people who were actually the finalists. They are actually online with us. And I will request them to switch on their camera when I ask them to, not right now. So we had invited abstracts in 9 categories. These were the 9 categories: screening, staging, early detection, pathology and molecular biology, intervention, pulmonology, board, diagnostic, therapeutic, early stage and localized disease, locoregional and oligometastatic, chemotherapy and advanced lung cancer, immunotherapy and targeted, pain and palliation, prevention and tobacco cessation. These were the 9 categories in which we had invited abstracts. We should have had a COVID and lung cancer, because you will not believe we at least got 7 abstracts with COVID and lung cancer. We did not think of that. So some learning for us also. How we did that we accepted all abstracts which came as posters to begin with. And because of the 2-week format of this conference, we allowed all posters to be presented in the e-poster hall. They were evaluated during the first weekend. The 5 which were the highest scoring posters were invited for oral presentation. Oral presentation was done today morning as a separate meeting because we didn't want to waste the academic time of this meeting. And then we came out to the best oral presentation. Now, what was at stake, and we managed to raise the stakes actually by having a best oral presentation prize of a cash prize of ₹1 lakh. We were able to do this because of, again, the virtual format, which allowed us to have some more funds at our disposal, unlike the usual in-person conferences where we spend a lot on hospitality. And not only that, we were also able to squeeze prizes out for the best poster category. Now, the best poster got ₹15,000, but we had 9 categories. So we are giving a prize in each category, which makes it 9 best poster prizes. All right. Now, of the abstracts, we got a record-breaking 90 abstracts in the 9 categories. So for me, 90 is a number. We were, there were different estimates how many we should expect. I was hovering about 50. Dr. Harit was around 150. 90, we somewhere stuck in between. And I am very sure that if we had allowed abstracts for a couple of more days, we would have crossed the 100 mark. But 90, I feel, is a very good number. And Dr. Behra will tell us how the previous conferences have done. And this is a benchmark, I think, which we have set for national conferences. They were evaluated during the first weekend, and we had a very studious jury. We requested Dr. Behra, who's the president of ISSLC organization, dedicated lung oncologist, pulmonologist, who to judge posters. Dr. Arun Goel, he is a very senior surgeon and academician. He also runs the DNB program at Max Hospital, Vaishali. He has extensive experience in evaluating such academic posters. Dr. Munish Gairola, again, he is the director of radiation oncology at Rajiv Gandhi Cancer Institute. Sir also is a DNB examiner and has multiple students under it. So we requested these 3 faculty to please judge the posters for us. And once they judged the poster for us, we were able to. My screen is not moving. Just a second. Sorry. I'll stop share and reshare. Okay. Okay. So Yeah. So the top five were invited for oral presentation, and these were the top five posters that scored highest. They are not in any order, but these are the ones which actually stood out and came on the top. There was actually a very tough competition. We had at least 8 posters who were in that we thought would be in the oral ranking, but each of them pushed each other by just a mark or so. So we had 2 posters from Mumbai, we had 2 from AIMS Delhi, and there was 1 from Lucknow. And we'll go into the detail of all of this. But before that, I want to bring in Dr. Behra sir. Dr. Behra sir and Dr. Arun Goyal. Unfortunately, Dr. Munish Gerola could not join with us. That sir, and I'm just talking today right now about the poster. What was your experience? What was your feel? It was unlike any other thing where students are standing next to poster talking about poster. You can ask them questions. You got a blank screen. You had to assess 90 posters. I know I asked you on a Sunday morning to give me a result by end of the day. So first Dr. Behra and then Dr. Goyal sir. Dr. Behra, you have to unmute.
Thank you, Dr. Shubham, and a very good evening to everybody. And Dr. Harit, Dr. Shubham, Dr. Arun, and other friends who are, I don't know, who are present here, who all have joined here. I think it is at the very outset, I must congratulate Dr. Shubham, Dr. Harit, and their team for such, I think, nice idea. That was the very startling thing I should share with you people, because this was the 10th, we are going on doing it since 2005. And as he has told, and I think during the inauguration, I had also said, this is the best Nalcon we had ever had. The participants, the academic content of the conference, of course, that we are not talking now. As regards the presentations, there are 90. This is a record, as Shubham has said. This is a record, and from all parts of the country, people have, participants have taken part. And as he has told very rightly, we had very tough time for some of them. They are so close to each other, at least because obviously we did not have any idea of amongst the 3 judges. We gave our independent markings and independent judgment. And again, I should share with you, it is exactly the way it had gone. I must tell you, these top 5 posters, maybe one little this way, that way, but it is exactly, these are the ones, the best ones. I think the best always stands out, let me tell you. And secondly, about the quality of, apart from the scientific content, the quality of presentation was, again, maybe whether they are because in the form of e-posters or something, I don't know. I am not a very, technical person that way, but they're so nicely, when you look at the poster, you will just be surprised to see the standard of the posters, the way they are presented, the brief, precise, to the point. So again, all these 5 people congratulate for this thing. And then obviously he's going to announce. I'm sure Dr. Shubham is going to announce the oral presentation one that will come. But again, there was also, when Dr. Goyal and myself, we are there again, the same thing I should say, how it is that but the only difficulty was there, the initial 3, 4, again they are so close, neck to neck. I don't know, maybe 1 mark this way, that way. So when they combined, again, that Shubham only knows. But again, I should say how, of course, I now, by this time, he has sent me the result. I could see that on my mobile. He has sent it, and then again, I am amazed.
Sir, I'm feeling you're about to say it, so don't say it. Sir, don't say it. Every time I feel you're going to say it.
I am not saying anybody. I am not declaring it. You will only declare the result. What I'm trying to say, how exact we are, so that again it means that the what I'm trying to say, the summary of all of it, that they're so good, the way it was presented, and the people who are chosen, That is what I am trying to say. Obviously, the name he will be trying to say. It was again my choice, and it is, I am sure, it was obviously Dr. Goel's choice. So therefore, the prize has come up that way. So again,
So
congratulations to,
let me get Dr. Goel also in, sir, because Dr.
yeah.
Goel is the most technical doctor that I know of, and I work with Dr. Goel. That, sir, what is your take on the technology and the e-posters that you have evaluated? I mean, I'm sure this is not a very usual experience, but how did the experience was, sir?
Uh, Thank you, Shubham. First of all, congratulations for the whole event and for really motivating so many people to come up with the submission of work. And I would say that the time I spent on evaluating posters was a very enjoyable time. I
Yeah,
always
yeah.
really feel that it is Indian work which should really come up in Indian conferences, and starting from Indian, it should really go to the international stage also.
Oh,
And
yes.
while we have five posters selected for oral, but I would say there were another five or so at least who were very good, and I might have been sort of happier if we had maybe more. And another thing which I would like maybe in future is not like we had a oral presentation which was sort of restricted to the faculty. I would like that good quality work gets exposed to the whole set of delegates. So this should be one of the prime sessions where high quality work is really everybody gets an opportunity to listen, and the basically the people who are submitting, they also really enjoy this. So in
Agreed.
future, I would suggest that we plan a session specifically for that.
Yes, yes. And I
And
will give you a review. Yes. Yes, sir. Yes. Please go ahead.
definitely appreciate that. And which I am seeing, some of them, it has been very high quality. So whether it is in terms of the clinical work which has been done, and many of them were focusing on laboratory studies also, so on both sides. So I think this trend, and probably the virtual format has given us a financial leeway to sort of reward such work, and also the opportunity for people, because a lot of other expenses or the time required to sort of get involved in events has been reduced. So I would say the future of virtual or a hybrid model would really allow us to take this forward. And I think that should be all from my side. Please
Great,
take
sir.
it
Great.
ahead.
Thank you, thank you, thank you. So I'll come to the oral presentation and why we had it separate. I'll just go about it. So I'll start with the poster winners, and we had one top poster in every category. We excluded the top; these top five were excluded because they were going for the oral. So we had the top posters were other than these five, and in each category, I'll be announcing the poster winner and the poster number. I would request that I will not have the time to go through the details, but if anybody wants to know the details of what their poster had, it's still in the poster viewing area. You can go to the e-poster section, go it. So I'll start with the first category, which was screening, staging, and early detection. The best poster we found was of Dr. Sneha. She is from the Department of Pulmonary Medicine at JIPMER. She talked about the impact of multidisciplinary tumor board on lung cancer diagnosis and management in a tertiary care center. Really, 100 patients they had evaluated. This is the poster. You can look at in detail. The next category is pathology and molecular biology, comparative evaluation of IHC versus FISH testing for detection of ROS1 gene rearrangement fusion in lung cancer. This was from Dr. Rajiv Kumar, Department of Pathology, TMH, Mumbai. Again, very extensive data, really something. And we are very happy that most of these topics were actually covered in our conferences. So it was very heartening to see that what topics that we thought or the scientific committee thought was important were actually reflected. So intervention pulmonology for lung cancer, both diagnostic and therapeutic. This was the best prize goes to the diagnostic yield of fiber optic bronchoscope guided biopsy in diagnosing various histopathological subtypes lung cancer in Kumaon region. This was by Dr. Priyank Goyal, Department of Pulmonology at GMC Haldwani. We were very heartening to see a lot of medical colleges, not just from the metros, but from the state capitals and even the cities coming in and submitting. We were very happy that we could reach so many people and get them to submit. This was his poster. Then this is a poster which actually was, fighting to get into the oral, and there was a lot of, he just missed the oral presentation by a mark. And this was, the uniportal data for VATS resection at Tata Memorial Center. And they had a data of 88 uniportal resections, wonderful data. This goes to Dr. Sayesh Reddy Vopuru from Department of Surgical Oncology at TMH Mumbai. A wonderful data. I must say that you should all go out and see these posters. That's why I mentioned the poster numbers. Locoregional and oligometastatic disease, a prospective study comparing dosimetry between CT-based radiation planning and PET-based radiation planning in treatment of non-metastatic NSCLC. This was really a prospective, very well-planned trial. I mean, we were looking at the methodology and we were so wowed by what methods they have used to randomize the patients. This was from the Department of Radiation Therapy at Medical College Hospital, Calcutta, Dr. Mondal. A very congratulations to Dr. Mondal and team. Then this is chemotherapy in advanced lung cancer, and this was a data of 228 patients over 4 years. This is clinico-pathological and outcome trends of stage 4 NSCLC over 4 years at a tertiary care center. Dr. Gunjan Srivastav from the Department of Medical Oncology at Max Saket. She talks about 228 patients over 4 years and how the change in treatment therapies with the availability of newer drugs has improved the survival. Again, a good, strong data presented, which made this poster to be in the top category. Then this was immunotherapy and targeted therapy. Again, something that actually Dr. Ramalingam was talking about, the effect of ramucirumab on progression-free survival and quality of life in conventional drug-resistant metastatic non-squamous variety of NSCLC, a pilot study. So although the number of patients was less, there were around 12 patients, but the thought behind the study, taking a pilot, starting a pilot, a wonderful idea. Again, one should have a look at the content of the paper. This is the poster that they had presented. Now, so this was pain and palliation, something which we at MICC are very fond of, tackling, which is usually missed in a lot of conferences. So therapeutic thoracosynthesis is as effective as idopovidine fluorodesis in alleviating dyspnea and malignant pleural effusion secondary to lung cancer. This again was a RCT, very strong on data, more than 100 patients on each side, a well-conducted trial. We were very happy with the results, and I'm sure this is from AIIMS Bhubaneswar, Dr. Mantha Satya Padmaja. I would request all to please look into it, because as we spoke in the morning today, between the pleural effusion, that this is something that we really need to tackle. And most of our cases, we sometime come across this. This was the presentation. Okay, so prevention and tobacco cessation. This is a category where we had only 2 submissions. So we would want to actually drive this area now. We have tried to put a lot of focus in prevention and definitely tobacco cessation. We had a full day devoted to prevention and early detection. So this was by Mr. Rishabh Agarwal. This is a NGO, I Can Care NGO, scientific approach to tobacco cessation using data-driven decision making. Again, very strong data. Usually preventive aspects data takes a long time to come, but they have really collected data. They have also proposed a app-based system how you can promote tobacco cessation. So many congrats to all 9 of these. We will put out a mail to all of this, and we'll try to somehow get this on our website also, so people can look into it. This is the poster that is there now. Okay, so now is the big prize, oral presentation, 7:22. I have 8 minutes to finish this. So these were the 8 presenters. Analysis of expression of PD-L1, L1, regulatory mRNA in lung cancer. And I will request all of these presenters, Dr. Sachin, Soumya, Dr. Roshan, Dr. Vinay, and Sriniket, to switch on their camera. And you'll have to speak something to be visible. Just say hi so that we know you are there. And we really want to, Dr. Goel said that we would wanted to have it in a full main session. So actually, sir, we had planned this 30 minutes to actually be this presentation, but you'll realize we took 1.5 hours to evaluate these posters. We started at 12 in the morning and finished at 1:30. So we were very sure that we will never be able to stick to time, and that is the reason we decided to do it away from the meeting. And I can tell you, I was there when these two judges actually evaluated, and I was so happy that I was not one of the person who's being examined by these two. I was so happy, and I'm very sure that they are the right people to judge a lakh rupee prize, because it has to be so well done that you give it to the right person. And so can I request Dr. Behra actually to announce the winner? As sir said, I've already told him. So Dr. Behra, and I will tell you also one thing, that both Dr. Behra and Dr. Goyal actually scored it independently, but unanimously they would realize that in their mark sheet it was the topmost presentation. So Dr. Behra, will you please do the honor, sir?
Yes, thank you, Shubham. As I have told you, it was so close, neck to neck context, and the marks were, it was very close. It was very difficult to decide, in fact, how to go, how to. I'm sure the same thing would have been with Dr. Arun. Dr. Goyal also would have thought that way, but I think I'm happy to announce that. We have the first prize goes to Dr. Sachin from AIMS for his work on microRNA correlation with PDL1. So
thank you so much, sir.
congratulations,
Thank
Sachin.
you. Thank you so much, sir. Good evening.
Yeah.
Welcome, Sachin. Welcome. Thank you. I think really it was. I actually want to hear from Dr. Goel and Dr. Behra that why did you choose? Because unanimously both of you had the highest marks for Sachin. So I just want a couple of lines that why you thought this was the best presentation, sir.
Dr. Behra, please.
You see, Shubham, why we chose this one? The point here is, this is the era of the topic is itself. The marks were divided into 5 different headings, as you know: the scientific content, the presentation, the timing, the question answer. It is not only the topic, it is every 5 section, each section given equal marks. I must tell to all the presenters, it is not only the content, the way they presented, the way they stick to the time, and also they true to our questions, the way they answered, the way they try to explain. So these are all 5 components which were taken into account, and every section was given different marks. That is one thing. And again, regarding this study, I am sure they have done a fairly large number of cases. They did about I think nearly 100 cases, 97 cases or so, if I remember, although I don't have the presentation right now, because I have remembered it was around 97 cases. They did mostly adenocarcinoma, and they studied few of the basic thing what they did about the correlation with the microRNA, the down regulation of 3 microRNAs. Sachin, I am correct? If I am correct that way.
Yes, sir.
They have tried, and then they have tried to correlate that further with the response to therapy. Although they have not used immunotherapy in these cases, because immunotherapy in our country is an issue, the cost issue. So they are given the other types of therapy, and they have tried to correlate, and I think that he could convey the message to very clearly to us. And the topic was important. It was conveyed to us very clearly, and some of the questions which we asked, he answered that to our satisfaction. So I think these are the type of things I should comment. That's how I had chosen.
Yes. Great, sir. Dr. Goel, sir, please.
Thank you, sir. What I would say is, firstly, I must compliment all the 5 speakers for doing a good job with good scientific content. But for me, basically, 2 I would like to sort of say this study by Dr. Sachin and the team. And the second one I would say is Dr. Vinay from Tata. Also, it was a very excellent talk and very well handled. And for me, they were really neck to neck. The only thing I can say which really takes this one a little ahead is it is a prospectively planned study, and definitely talks about some of the cutting edge issues which are we are talking about in this field, including say PDL1 and correlation with microRNAs. So an element of innovative thinking and assessment also. So that I would say really clinched it for me. That's it, I think. Good.
Thank you, sir.
Thank you so
Thank you
much.
so much. Thank you, Sachin. Many, many congratulations, Dr. Sachin.
Thank you,
And
Dr.
just
Subha.
thank you, Sachin. Thank you. And just what Dr. mentioned, Dr. Goel mentioned that actually all of them were so good and just separated by 1 mark. Actually, we spoke in detail and we decided that those 4 presentations who did not actually get the first prize, we will be giving them a cash prize of 20,000 rupees for all those 4 presenters who actually did not get the best oral presentation but were better than the rest and were presented today. So we will be giving not just the top prize, but 4 other separate prizes of 20,000 each to the 4 presenters, which include Vinay, Dr. Vinay, Dr. Sriniket, Dr. Soumya, and Dr. Roshan, along with the best poster.
Thank you very much, sir. Thank you.
Thank you.
Thank
Very
you.
good.
And
Ah.
many congratulations, Vinay. Many congratulations, Sriniket, Soumya, and Dr. Roshan.
Thank you, sir.
Great to
So
have all of
please,
you.
please congratulations and continue this work. And you see
Yeah.
in this country, I think we expect you people to continue. The prize or no prize, that is immaterial.
Yeah.
But I think that
Yeah,
is
ultimately,
yeah.
that is, I think, a very great statement from you, sir. Ultimately, it should not be the price which is the driving force. The satisfaction of doing good quality work and presenting it in itself has to be the driving force.
Yes, sir. That is true, sir.
Okay. Thank you so much. Thank you, everybody. And with this, these are the posters, and I request everybody that our site is going to be live for another couple of days. So if anybody wants to look at these posters, especially the prize winning ones, the special mentions one, please go into it and have a look. Thank you so much.